Hello, I'm Dr. Corey Vaughn, otolaryngologist with Ear, Nose, and Throat Center of the Ozarks in Northwest Arkansas. In this video, I'm going to talk to you about sinusitis, or otherwise known as rhinosinusitis. Sinusitis, or otherwise known as rhinosinusitis, is in general terms inflammation of the sinus and nasal lining, which we call mucosa, and the associated symptoms that result from such inflammation. It is estimated that sinusitis affects approximately 37 million people in the United States every year. Common symptoms of sinusitis typically include facial pain, facial pressure, nasal congestion or stuffiness, nasal drainage, and a reduction or complete loss of smell. Other less common symptoms can include fever, general fatigue, cough, ear pain, ear pressure, sore throat, and headache. We classify rhinosinusitis in terms that are associated with the longevity of symptoms. Acute rhinosinusitis is defined as symptoms lasting for less than 4 weeks. Subacute rhinosinusitis is defined as symptoms lasting between 4 and 12 weeks. And chronic sinusitis is defined as symptoms lasting for longer than 12 weeks. Acute rhinosinusitis is due to allergies or an upper respiratory virus with symptoms lasting for 10 days or longer. When there is associated colored nasal drainage, severe pain over the sinuses, fever, or no resolution of symptoms after the first 10 days, there's more likely to be some association with an actual bacterial infection within the paranasal sinuses. Typically, these symptoms are treated with a combination of medical therapy that may include nasal saline irrigation, intranasal or oral corticosteroids, intranasal or oral antihistamines, other oral allergy medication, mucolytic agents, or oral or intranasal decongestant medication. Chronic sinusitis is defined as symptoms lasting longer than 12 weeks. Patients with chronic sinusitis are further classified as having symptoms with or without the presence of nasal polyps. It is speculated that up to 15% of the US population has complaints consistent with chronic sinusitis. Approximately 4% of patients also have the presence of nasal polyps within the paranasal sinuses. Unlike acute rhinosinusitis, the causes of chronic rhinosinusitis can be much more complex. Persistent allergies, recurrent or chronic bacterial infections, chronic fungal infection, immune dysfunction, anatomic abnormalities of the paranasal sinuses, trauma, and poor sinonasal mucosal function can all play a role in the development of chronic sinusitis. Patients whom we suspect a chronic rhinosinusitis diagnosis, treatment often begins with an individualized medical approach consisting of nasal saline irrigation, intranasal or oral corticosteroids, intranasal or oral antihistamines, and potentially other medications like oral allergy medications, mucolytic agents, and sometimes decongestants. Often, a prolonged course of oral antibiotic treatment may also be recommended. In order to perform a more in-depth physical examination, a nasal endoscopy may also be performed. A nasal endoscopy is where a fiber optic camera is used to visually examine the majority of the sinonasal cavity. This allows us to get a better idea of the sinonasal mucosal health and anatomy. When complete examination of the sinuses is necessary, a CT scan of the sinuses is performed to evaluate the remaining aspects of the sinonasal cavity that are not able to be visualized during a nasal endoscopy examination. A sinus CT scan is a relatively quick, painless radiologic imaging procedure without the need for any injection of contrast or other IV fluids. When we review and evaluate a patient's sinus CT scan, there are many things that we are looking for. These scans provide us details on a patient's sinus anatomy and how it may contribute to their chronic rhinosinusitis complaints. These scans can also give us some idea of the inflammation of the sinus mucosa and sometimes provide us clues on the type of infection that is occurring in the paranasal sinuses. Lastly, a sinus CT scan can be used as an additional tool in the operating room if it is deemed that the surgical treatment for one's chronic sinusitis complaints is necessary. The failure of medical treatment to relieve ongoing sinusitis symptoms or to prevent recurrent sinus infections, the presence of nasal polyps within the sinonasal cavity, localized fungal infections, or large allergic responses to fungal infections within the paranasal sinuses are all common reasons to have sinus surgery. Sinus surgery is an individualized and tailored treatment that is dependent upon patient-specific factors such as their sinus disease history, anatomy, and overall sinonasal mucosal health. The purpose of sinus surgery is to rid the sinuses of infection or disease that is present, to improve the ventilation of the sinuses, and to enlarge the natural sinus opening, which facilitates the use of topical intranasal therapies postoperatively. This is all accomplished by removing small aspects of bone and tissue that are blocking and separating each sinus from the general nasal cavity, or by expanding the natural opening of the sinuses through the nasal cavity with localized pressure. All of this is performed through a procedure termed functional endoscopic sinus surgery, where the entirety of the surgery is performed within the nose with the visual assistance of a fiber optic endoscopic camera projected onto a high-definition operative monitor without any incisions performed on the facial skin. Surgery on the sinuses has been performed for many, many years. With advancements in both techniques and technologies, the surgery has gone from an invasive, intense, and uncomfortable experience for patients to one that is minimally invasive, safe, and tolerable. With the development of smaller fiber optic endoscopes and angled fiber optic endoscopes, we can now see into and operate on areas of the sinuses that were previously missed. High definition and 4K monitors are allowing us to see subtleties in the sinuses that were not able to be visualized before. In a large percentage of cases, we use the patient's sinus CT scan to perform what's called extradural sinus navigation. This is where our surgical instruments are directly registered and overlaid onto the patient's CT scan so that we can see where our instruments are in real time, both with the camera and on the CT scan itself. The use of extradural sinus navigation techniques allow us to ensure that all aspects of the sinonasal cavity are addressed appropriately and safely. In specific patients, balloon sinuplasty may be a recommended surgical treatment. Balloon sinuplasty is a technique where sinus-specific balloon devices are introduced into the openings of the various sinuses in order to enlarge their natural opening without necessarily having to remove any tissue. A big advancement in sinus surgery has been the development of steroid-eluting sinus stents. We know that the best way to optimize surgical outcomes after sinus surgery and to promote good healing of the tissues is to provide corticosteroids to the local tissue of the paranasal sinuses after surgery. Traditionally, that was done, as it is often still done today, with the use of topical corticosteroid nasal sprays and nasal washes. Steroid-eluting stents are small devices that are placed within the sinonasal cavity at the time of surgery. After placement, these stents will elute a constant dosage of corticosteroids to the surrounding opposed sinonasal tissue. These stents have shown improvement in tissue healing, reduced polyp recurrence, and reduced the need for postoperative interventions like the use of oral corticosteroids and the need for repetitive surgery in certain sinus disease states. These devices will actually dissolve on their own over a 4 to 6 week period. However, the surgeon may recommend removal earlier.